Hello, we're back. This is Dr. Hart, and I have 3 practice questions on the content that I covered earlier today. This is on the mental health assessment of older adults. These are 3 practice questions. Let's get started. An elderly client who lives with a caregiver is admitted to an emergency department for a fractured arm. The client is soaked in urine and has dried fecal matter on the lower extremities. The client is 6 feet tall and weighs 100 pounds. Which condition should the nurse suspect? All right, here are the answer choices. Inability for the client to meet self-care needs. B, Alzheimer's dementia. C, abuse, neglect, or both. And D, caregiver role strain. So I'll give you a minute to think about what the answer might be. Don't forget to like, share, and subscribe to my YouTube channel, Nursing with Hart, PhD. All right, let's take a look at this test question. Okay, so the elderly client has a fractured arm, soaked in urine, dried fecal matter on the lower extremities, 6 feet tall and weighs 120 pounds. Okay, and the correct answer on this one is letter C, abuse, neglect, or both. This is what the nurse should suspect. If the nurse is seeing this in the client, the nurse would suspect abuse, neglect, or both. Let's look at the other answer choices and why they're not correct. Letter A, the client is likely, letter A is inability for the client to meet self-care needs. The client is likely unable to care for self along with the fractured arm, points to abuse and neglect. Letter B, Alzheimer's dementia. The client's condition points to abuse and neglect, not Alzheimer's. And letter D is caregiver role strain. The client's condition points to abuse and neglect. This doesn't have anything to do with the caregiver. Okay, so the clues in this stem of this question that point to abuse, neglect, or both. The fractured arm. The client is soaked in urine and has dried fecal matter in the lower extremities. The client is not being cared for properly. And the client is 6 feet tall and weighs 100 pounds. So 6 feet tall, 100 pounds, that's a very low BMI. That would be someone who is emaciated, who is not eating properly. Okay, so that's the first question. Let's go on to the next one. An elderly, emaciated client is brought to the emergency department by the client's caregiver. The client has bruises and abrasions on the shoulders and back and multiple stages of healing. When directly asked about these symptoms, which type of client response should the nurse anticipate? And this was in the lecture that I covered also this morning on elder abuse. So here are the answer choices. Letter A, the client will honestly reveal the nature of the injuries. Letter B, the client may deny or minimize the injuries. C, the client may have forgotten what caused the injuries. Or D, the client will ask to be placed in a nursing home. Let's give you a second and we'll come back. Okay, and the correct answer is letter B as in boy. The client may deny or minimize the injuries. The nurse should anticipate that the client might deny or minimize the injuries. The older client may be unwilling to disclose information because of fear of retaliation, embarrassment about the existence of abuse in the family, protectiveness toward a family member, or unwillingness to bring about legal action. Okay, so in most cases, the client, elderly client who is in a situation of abuse or neglect is most likely going to deny or minimize the injuries for those reasons that I listed. Let's look at the other answer choices. The client will honestly, letter A, the client will honestly reveal the nature of the injuries. Okay, this is not a likely action. The client is not likely to reveal the nature of the injuries. Letter C, the client may have forgotten what caused the injuries. Okay, this is not a likely action by the client. The likely, if this is what the client's going through, they're not likely to forget what they've been through. And letter D, the client will ask to be placed in a nursing home. Again, the client is not likely going to ask to be placed in a nursing home. That is, for most older adults, that's the last place they would want to be placed, is in a nursing home. Most clients really desire to live at home as long as they can. All right, one more. This is a select all that apply. Hank is an older adult widower who lives in a long-term care facility. Recently, Hank has been complaining of fatigue, sleeping excessively, and refusing to engage in unit activities, including meals. When the nurse asks Hank about these symptoms, he sighs. "Don't worry about me. I'm just a tired old man who is waiting to die." Which questions are most important for the nurse to ask Hank? Select all that apply. And don't forget, when you're answering select all that apply questions, it could be one answer choice, it could be two, it could be three, it could be all four. Okay, so it doesn't mean necessarily that there's more than one, there's more than two. It could be any of these or all of these. Okay, and here are the answer choices. Letter A, are you thinking of hurting yourself? B, should I call your family to cheer you up? C, how long have you been feeling this way? And D, would you feel better if you came to dinner? We'll give you a minute on this one. Okay, and the correct answers, there's two of them. The correct answers are letter B and C. All right, let's go over the other answer choices. I'm sorry, did I say B and C? I meant to say A and C are correct. A and C. A is, are you thinking of hurting yourself? That's a very important question for the nurse to ask in this situation. The client is having a somatic symptom of depression, fatigue, has verbalized feelings of hopelessness, waiting to die. The nurse's first priority is to maintain patient safety. Therefore, the nurse must assess Hank for risk of suicide. Asking Hank if he's thinking of hurting himself is an appropriate question to ask. Okay, letter B is incorrect. Hank is expressing a somatic symptom of depression, fatigue, and has verbalized feelings of hopelessness. Nurse's main priority is to assess Hank for risk of suicide. Asking him if he'd like to call his family is not a priority. Okay, and letter C is correct. Hank is expressing a somatic symptom of depression, has verbalized feelings of hopelessness. The nurse must determine how long Hank has been feeling depressed. The longer a patient feels depressed and hopeless, the higher the likelihood the patient seriously contemplates suicide. And letter D is incorrect. Hank is expressing symptoms of depression. The nurse's main priority is to assess Hank for risk of suicide. Asking him if he'd like to have dinner is not a priority at this time. Okay, and that's it. 3 quick questions. We'll see you on the next one. Have a great day. Don't forget to like, share, and subscribe to my YouTube channel, Nursing with Hart, PhD. I'll see you on the next one. Bye for now.